So what is the first thing we can do to care for each other?
Well, I like to think about being aware of my surroundings and those around me. So as I think about interacting with others, either on the phone or through FaceTime, recognizing that everyone can show up differently. So being aware of a change, and then also thinking about how I'm paying attention to those around me. So recognizing and identifying are really important. That's probably the first step, is being aware.
So if I do see someone who has a need, what is something that I can do next for them?
So I like to think about this in terms of, once I've recognized that they may have changes in behavior or mood or more physical complaints, I like to remind myself that my job isn't to fix it for them. I like to think of us as being side by side in this process, and that my job is just to listen and be present. So letting them tell their story in the way that is meaningful to them, not interrupting, and then not interjecting my own thoughts or stories, really letting them share their story in the way that they see fit.
And along those lines too, could you check in with someone over like FaceTime or video time? Like, I guess for me, what would be the way that I even see those cues if I'm not with that person all the time?
That's a great question, and I was actually thinking about that this morning. So if I'm connecting with someone typically by FaceTime, then obviously you have those facial cues or concerns that they may raise. The other way might be if I always am texting. Texting is a great way to connect. And if the person I'm texting doesn't respond, or the response is out of character for them, those might be ways that you would see that this is different, that this is something that you might want to follow up on.
So really paying attention to the cues that they're giving you, whether it's over video or a text message. So what do you say to someone who worries about how to respond if the conversation is really emotional?
Yeah. And I think that's one of the reasons people feel uncomfortable having these conversations, is that they worry about what they might do or how to respond when there is a lot of emotion. And if I remind myself that my job isn't to fix it, but to listen and be with them, to reflect back their emotion or to acknowledge their emotion. You seem really frustrated, you seem really sad. It allows for two things. One is they can correct me. So I sound like I'm frustrated, but really I'm very sad. Mm-hmm. So it allows for that opportunity, and then the conversation can flow following that. The other piece that acknowledging the emotion does, it creates the safe space. So I know that I can go back and connect with that person if I'm not doing well in the future. If the emotions aren't acknowledged, often that's kind of the ending of the connection, and that's not what our goal is.
Having open conversation sounds like something that people really need to be doing during this time. We just got a question on Facebook. Someone wants to know if you can tell the difference between shortness of breath or anxiety during this time. Is that something you can speak to at all?
Oh, that's actually a really good question. So when you're anxious, you can feel short of breath. And so as I think about that in terms of the shortness of breath related to COVID, are there any other symptoms that go with that? So a fever, cough, change in taste or smell, those things might indicate that the shortness of breath is more related to a physical ailment. If something just occurred that was stressful or a difficult conversation and the shortness of breath may be linked to that, that might more point towards anxiety.
So really understanding your body, I think, is important during that, and knowing your own cues about what you might do during anxiety to typically get shortness of breath, I think is something people need to think about. So after you've had these conversations with people, what is something that I should do next?
In that spot, so you've been aware, you've recognized, you've listened, you've acknowledged the feelings and reflected those back, I would want to make sure that I ask and verify that the person I'm speaking with has someone to talk to. ask how they're going to take care of themselves, what are they going to do over the next little bit, and then ask if it's okay to follow up with them later in the day, the following day, and then if there's anything that they need in particular at that time. And that allows for me to check back in with them and to know, do they have the things that they need to be safe?
That's great. And I know that there's lots of resources out there that people can use. Can you speak to any of those resources that someone can contact if they're wanting to talk to someone?
So we are in the process of working with our partners here, our other teams at Intermountain, to create a process for that's going to be simple and streamlined. And we'll be hearing more about that next week. I want to make sure that people know about the crisis line. If you're an Intermountain caregiver, employee assistance program, your primary care physician, your supervisor, someone at work, it would be a good resource. And I think you've got a list of those that you'll share with everyone at the end of this time.
I will, yes. And is there anything else that you wanted to talk about today in terms of self-care and just making sure that you're in touch with not only your own emotions, but also those around you?
Yeah, thanks for asking that question. I think at this time, more than any time in my career in medicine, we recognize the importance of those around us and our community of caregivers at Intermountain, and then our community where we live, and how to create those connections and how we look after each other is really going to be an important part of how we come out of this crisis stronger, healthier, and with a stronger commitment to each other.
Well, Anne, thank you so much for joining us. We really appreciate it. And those resources that Anne was talking about, there's the National Suicide Prevention Line. University of Utah also has a state crisis line that you can contact. We also have a Trevor hotline for LGBTQ members that they can use, and a veteran crisis line as well. Those numbers should be appearing at the bottom of the screen right now, and we can also post them for you later. Also, please remember, a medical emergency is still an emergency, and if you need to seek care, please come to the hospital. We don't want to turn anyone away right now that really needs the care, and we want you guys to feel comfortable and safe in the hospital, and our hospitals are safe right now. If you have any concerns about COVID-19 and would like to speak to someone, you can access our COVID-19 hotline at 844-442-5224. Or you can visit our website at intermountainhealthcare.org. We have a symptom checker available online in the bottom right-hand corner that you can use. Thanks so much for joining us. We'll talk to you guys next time.